Well, it's another episode of Don't Say the Q Word, and actually, after a weekend of lots of pomp and ceremony with the Trooping of the Colour celebrating the King's birthday, of course the King's Birthday Honours List has been announced, and one of our own is on that list. Yes, the Nottingham Children's Hospital Youth Service Manager has made it to the list and is going to be awarded a BEM, a British Empire Medal, for services to children and youth work. We're going to find out a bit more about what that actually means and who she is. Welcome to Don't Say the Q Word, Donna Hilton.
Good morning, thanks for having me.
It's great to have you on. I mean, can you believe it when you're hearing me say those words, King's Honours List, a BEM? I mean, you must be on cloud nine right now.
Yeah, completely. It feels so surreal still. Amazing. I can't describe it. It just feels incredible. I never thought that, you don't set out to do work to get an honour, but when you do something you love and get recognised for it, it's absolutely, one of the best moments I think I've ever experienced. So yeah, really, really proud and honoured.
We'll talk about what's to come and when you're going to get the award and how that's going to work, and I'm sure you're very excited about that.
Yeah.
But just explain a bit to us, because there'll be people listening and watching who don't realise there are people like you in hospitals like QMC or City or wherever around the UK. So what is your job then? Explain a bit about what you do.
I now oversee the youth work team, but when it started back in '98, so youth work is basically around supporting young people with personal and social development, enabling young people to develop key life skills, confidence on their journey into adulthood. So that's what youth work is in a nutshell, and in a hospital setting. There's many young people. We work with young people with long-term health conditions. Many of them wouldn't have access to youth provision in their communities, and the job was initiated with a lot of young people struggling with their kidney problems, their kidney disease. That's where my post started as a pilot. You think that youth work helps people in the community, and everybody is busy doing the job for the patients in the hospital, but no one is there purely to focus on that young people's needs. There's a quote in youth work that talks about, doctors, nurses seeing young people as patients, teachers seeing them as pupils, maybe therapy workers seeing them as clients, but we're actually one of the professions that actually sees them as young people. So it's about getting to know that young person, building the relationship, finding out what is in that young person that needs bringing out for them to be who they're meant to be.
There's a lot involved. I'm sure there's a lot of challenge involved in that.
Yes, yeah, lots of challenges. Some days can be really tough. We've lost young people over the years due to health, and that's been probably one of the hardest parts of the job. But then you do the flip side to that, and seeing young people who have walked in the door that have no confidence, don't communicate, to become the wonderful, confident young people with vocational goals. To see their journey and step it with them is just absolutely fantastic.
Don't say the Q word. And when this job came up back in the late 90s, you'd worked with young people, you'd done youth work, but not in hospitals up to this point, and you didn't know such a thing existed. Well, in fact, such a thing didn't exist, did it, back then?
No, not at all. I started out in youth work. I started out as football coaching, to be fair. I thought I'd always be either a PE teacher or a football coach, and I was doing a lot of work around that. And it was at the time when they were really trying to promote girls and young women's football. And I was coaching in a youth centre and doing some girls' football coaching. And a youth worker said to me, you've got a real talent with young people. Have you ever thought about that as a career? And it's something that I hadn't. I'd been to youth clubs as a teenager, but for me, it was more about, it wasn't just the football coach, it was investing in young people. And it was really nice that someone had seen that in me and said, what do you think? So that for me, I took on an apprenticeship at that point at that very youth club, and then went on to do my youth and community degree at uni. And I had so many placements and part-time jobs. So I'd done youth club work and street work with young drug users, school exclusion work, sports coaching, but yeah, hadn't done anything health-based. And as you say, it didn't exist at the time. So when I was just sort of finishing uni and saw the job pop up in the renal unit, which was at the City at the time before Children's Services merged. I thought, wow, that's a new challenge, and yeah, and here I am now.
I mean, it's not just this service at NUH that's developed over those years, is it? I mean, because this was so new, and probably the first in the UK as NHS trusts go to have this youth service. It's been a bit of a flagship, hasn't it, for other NHS trusts over the years?
Yeah, again, really privileged and proud that we're like the pioneer service. So it's one of the things that other hospitals have seen. We've written a few papers and shown some of the outcomes that some of our young people have developed over the years, and other hospitals are saying, wow, we need to invest in that. So yeah, it's been great that I've supported probably, 25 plus hospitals to set up their own, either to get a youth worker or a youth service. So that's been great to spread the word nationally, and just to see that develop. So I remember supporting a service down in Wrexham. They were initially a youth work mental health service, and they've developed now to work in diabetes and other conditions. I helped them put together a Welsh lottery bid, and they're still going, and they've developed their service. And it was myself and the manager that worked there at the time. We stayed together for that peer contact, because it can be quite a lonely role while you work with so many multidisciplinary teams within the hospital. You kind of you miss that youth work contact and supervision. So we used to meet regularly and said, this is really valuable. And so between us, we decided we would, as the youth work was growing nationally, we've set up a health-based youth work network, and that's still going now. I think we're in its 16th year, and I'm fortunate enough to chair that group and meet other passionate health-based youth workers around the country. We have conferences and coffee and chats online, and whether it's supporting new youth workers in the role, or someone saying, Donna, have you got a policy for this? Or I'm really, have you come across this barrier? Have you got any ideas for this? And it's great. It's a really good sharing platform. And what's special about the hospital curriculum is that we add in, so there's lots of things, there's personal development, leisure and recreation, participation, health and wellbeing, life skills. And then the last triangle that is specific to hospital youth work is the independent healthcare. So we really want to support young people in their journey of managing their health condition so they can embrace adulthood and adult services.
Well, we're sitting here you talked about games consoles.
Yeah.
There are actually traditional board games up on the shelves, which I'm very pleased to see. But yeah, games consoles, we're sitting on these sofas. This is like your kind of youth room, isn't it, as well as your office?
Yes, yeah.
Because it's, I guess, and you've kind of hinted at it anyway, but it's really important. You said about treating them not as patients but as people. Yes. Which is key to your job.
Absolutely.
And, hospitals are never a good, fun place for anybody, whether you're visiting or you're a patient. But I guess for young people, it's even more important to make them feel like, try and provide a home from home, as difficult as that is. I guess that's part of it, to get them to relax, to get them to engage with you.
Absolutely, and this if these walls could talk, there's so many examples of people offloading or chatting or work that's gone off in this room that wouldn't have happened if we didn't have this room, or it was on a ward. Whether it's someone that just sits on here, sighs and gets a cup of tea and has a bit of a snooze because they just want to get away from the ward and the noise, or we have drop-ins so they can come together with other teenagers that are in hospital and just, having a board game. You mentioned board games. I'm a big board game fan myself, but I like to, again, see beyond the board game. That's our tool. So the amount of times we've had young people that don't want to speak, don't want to connect with peers, you get something like a board game out and they're communicating, they're problem solving, they're making decisions, they're chatting, and it's, no one sort of likes giving that eye contact, but we could have an art and craft activity or a board game or something, and young people are doing things, but they're talking at the same time, and they might not give you that eye contact, but they might be saying what it's like to be in hospital, what it's like to have that condition, and then someone might say, oh, I've got that condition, and oh, when do you take your tablets? And sometimes we can step back because then the conversation takes over with the young people. And I would say our biggest outcome is peer support, and just seeing young people, light up when someone else actually understands what it's like to be in their shoes, and they can then, we're the facilitators. They're the ones that can really connect. It's just great. I remember one young person coming into that building. He'd had kidney disease. He was on and off dialysis. His home setup wasn't fantastic. Didn't have support. He lived at home with dad, with I think 4 siblings, and he was very small for his age, and that comes with part of the conditions. You are different to your original peers, and he was bullied, I think, at about 3 different schools, moved. Well, anyway, the joy of that youth club is most people come from home, but it's so close to the hospital, we can get people off the wards for a break on a Wednesday evening. And he came down and he was playing pool, and he got this pool cue in his hand, and he was just looking around. And I said, "Are you okay?" He said, "I can't believe I've been here nearly 2 hours and no one said a bad word to me." And that was his life. And they're the things that really get you, and they're the stories. It could be something like that, or something massive like someone going off to university and doing a youth work degree, which we've got stories of young people going into youth work because of their experience. But it's all those little moments that really capture why we do what we do. He had a safe place, that he wasn't bullied, and people understood him, and that's just priceless. It's great. So,
and after 28 years, you just recounting that one story, of which there'll be hundreds, I'm sure.
Yeah, I should have.
You still feel it?
Oh, completely. Every time, it's those moments that take you back, and it hits hard, and you think, this is why we do what we do. And yeah, I could probably write a book on the amount of case studies. Yeah,
and however little that challenge is, it's that sense of achievement, which is huge for them and what they're going for.
Yeah, definitely.
Don't say the Q word. It's so clear with the way you talk, with these examples you give of just little achievements, those little rewards, those massive rewards, that 28 years on, you're still probably as passionate, if not more so, than you were when you started out. A much bigger team. There was just one of you back in 1998. Now there's a big team and volunteers as well, so you can do amazing work here. You spread the word across the NHS, and you've got other trusts doing very similar team setups with youth work, which is fantastic. So I feel like I don't really need to ask you why you've been included on the King's Birthday Honours, which is, talk about achievements. What an achievement for you.
It feels incredible, and I think you've touched on team and other people I've worked with, and it's the right time to sort of acknowledge people that I've worked with. Currently, I have a wonderful team of 6 who are all fantastic in many different ways, which makes us a great team. Our volunteers, couldn't do the work without them. They are fantastic. Some of them, we've got one volunteer that's been with us for nearly 20 years. I met him when he was, 12, and he's, in his 30s now, and people like that, and my national colleagues as well. And I think I'm, as much as, this award is fantastic for me, and I'm so honoured, and I know that there's so many people that have said, well deserved, it's great, and that means a lot. But yeah, just the colleagues that have been with me along the way, and past and present, have walked that journey. I've learnt from them, and that all shapes you into who you are. And yeah, it's really proud to be acknowledged, to be recognised, and for actually people to put me forward for this. It just means so much. It is literally the highlight of my career, and yeah, I'm just completely overwhelmed, and I'm really thankful for the people I've worked with along the way, as well as the medical professionals. I think I've had some people that have fly the flag for youth work, doctors and some of the specialist nurses I've worked with, that I didn't know anything about hospital. I remember coming into it eyes wide open when I started. I think they didn't know what I did. I didn't know what they did, and all the abbreviations that are used, and it took me, I think, 2 weeks to work out that BP was blood pressure, for example. That was my knowledge, but learning from them, young people as well, they're the biggest teachers. I've learned so much about health conditions, not just from my medical colleagues, but the young people themselves. And I think all part of that really helps you grow in a role and believe in what you do. And I love it. I absolutely love it. I remember someone saying to me, wow, I can't believe, you're still in that job. Have you not got bored? Every day is different. I always use the analogy, I've watched this service grow from an acorn into an oak tree, and that's just been something that's so, yeah, it fills me with pride, and there's so many people that make up the branches of that tree, and it's just, it feels incredible. I just don't have enough words, actually, but yeah, I feel really proud and honoured.
And your dad's immensely proud.
Yeah, yes, got a shout out to my dad, and hopefully my mum's looking down on me somewhere, but yeah, he's just so proud. He's just, all the time. And obviously we knew about the award a few weeks before. They send you a letter from the palace that let you know you've got the award. And then on the day, on Saturday when it was in the Gazette, I got another letter from the Lord Lieutenant making it official. But I remember I was on holiday in Cornwall last week, and my dad phoned me halfway through, and I'm thinking, oh no, is he okay? And he said, can I tell anyone yet? And he's been desperate to break the embargo, and I said, from Saturday, Dad, you're absolutely fine to do. So yeah, it's really nice, and to have that support and honour from my dad and my siblings has been, it's been great.
Fantastic. So when do you actually get your British Empire medal?
So I believe, I had a letter congratulating me, and then they say that probably I'll get an invite to receive the medal from the Lord Lieutenant in around 2 months, I believe, and then I'll get another invite. I get to go to a Royal Garden party, so that's really exciting. And of course, my dad will be by my side. He'll be my definite +1. But yeah, so it's so that's all I know at the moment. It's still quite new, and yeah, I'm excited to see. To obviously get the medal and get along to a garden party. That would be amazing.
And finally then, what words of wisdom, I mean, you seem the perfect person to give words of wisdom with regards to youth work, particularly in hospitals, what you'd like to see happen next, what you think has been kind of the greatest achievement. What words of wisdom would you give to somebody else, not necessarily in the NHS, but who's listening and watching this now, developing youth service? What would your bit of advice be?
I think the massive thing is don't ever stop believing in what you do. Be patient. Things don't happen overnight. It's taken a long time to develop this service. All of our posts started out as charity, and you have to work hard to get the trust to take them on. Because we're not seen as the medical setup, I mean, I would say it's an essential role for young people's well-being, but some people say it's a luxury role, but it makes up that critical part of the MDT, but it doesn't happen overnight. You can't do it on your own. You have to use the skills of those people around you, whether it's other youth workers nationally, locally, the medical staff and teams you work alongside, and you bounce off one another and to meet the needs of these young people. So yes, I would say patience, resilience is a massive one, because you do get setbacks and you think, oh, here we go again. But for me, it's the young people. You really draw from I've only touched on some of the case studies today, but those young people that you see and their stories, just keep going. Hold on to that to inflate your balloon, so to speak. If the young people are the gas in your balloon, you can get rid of the sandbags that are weighing you down. And I think, that's really important. So patience, resilience, determination, believe in what you do, and then do rely on those around you. Wonderful. And enjoy it. That's the key thing. Yes, there's hard times, but find some enjoyment in what you do. So that is what I would say.
Well, you clearly do. It comes out of you with so much passion and joy, which is great to see. Donna, thank you for joining us on the podcast. Thank you for sharing this amazing moment in your life and your career. Congratulations again, and I'll leave it to you to sign off today's episode.
Thank you. I'm Donna Hilton, BEM, and thank you so much for having me on this podcast. It's been great talking to you. And remember, don't say the Q word.